and we're so thrilled to have Dr. Jill Biden with us today, and I have the great pleasure of introducing a couple of my bosses too. So Regent Alana Spiegel and Regent Leslie Smith right here. So thank you for being here. And so we are incredibly proud of the work we do here at CU Anschutz, and so thrilled to have Dr. Biden here to talk about the White House initiative on women's health research. And we are the perfect place to do that because we have the Ludeman Center right here for women's health research. And thank you to Lyda for being here as well. We're incredibly grateful for you. So we don't have much time, so I'm not going to say anything else except to thank you all for coming. And next up is going to be Dr. Biden, along with Lieutenant Governor Prima and Mayor Mike Coffman. So with that, I'm going to take my seat. So thank you all once again.
Welcome all of you to the Anschutz Medical Center, which in the city of Aurora. So as a mayor of the city of Aurora, I'm extremely proud of this campus, and we hope to grow it in terms of to be a major medical research center that is competitive not just in the United States but internationally. On behalf of the people who work and live in our great city, I'd like to again welcome you. I want to give special recognition and thanks to Lieutenant Governor Diane Primavera and to our First Lady, Dr. Jill Biden, for spending time in Aurora today. You will hear from both of them shortly. We're here today to talk about women's health and the need for our country to do more on women's health research. I applaud the President and the First Lady for their efforts to improve the health and lives of women throughout our country. You chose a great place in Colorado to discuss these efforts. Aurora has one of the largest healthcare and bioscience ecosystems in the nation. The Anschutz Medical Campus currently has 38,000 employees, 4,500 students at the University of Colorado, thank you, Todd, and an annual economic impact of $10 billion, which is some of the best and brightest from around the world are here working to make people's lives better through medical backgrounds, providing leading-edge patient care and education for our country's future doctors and researchers. It is already an amazing campus that, for example, provides a research physician the opportunity to see patients in one of the three major regional hospitals, teach a class at our medical school, and work on a research project and one of the labs on the Fitzsimmons Innovation Community, all within walking distance. I serve as the chairman of the Fitzsimmons Innovation Community, and the vice chairman is Don Ellman, chancellor for the University of Colorado Anschutz Medical Campus. Together we continue to focus on attracting more bioscience innovation companies to the campus in order to make it more competitive, not just nationally, but internationally. The work that's done on the campus is critical to our country, and consequently, the campus is critical to our city. So with that in mind, I thank all of you for being in Aurora today at the Anschutz Medical Campus. Now I am pleased to welcome our Lieutenant Governor, Diane Primavera. Thank you.
Well, good afternoon, everybody. First, I would like to welcome Dr. Biden to our snowy Colorado. We're honored to have you here with us today. We have proudly welcomed you to Colorado on visits, highlighting our nation-leading work to fill in-demand jobs and build the workforce for the future. And we're proud to welcome you here today to highlight another key focus, the importance of investing in women's health research. It's a pleasure to join you today to highlight women's health. And to highlight women's health research and the important work we are leading here in Colorado. The governor and I are so excited to see the Biden-Harris administration leading the cancer moonshot. and the White House Initiative on Women's Health Research. We know that equitable research exploring the impact of aging and disease specific to women is long overdue, and we're so glad to see strong leadership working to change that here at CU Anschutz and also in Washington. As a single mom myself and a grandma who's been diagnosed with cancer on 4 separate occasions, I know that healthcare plays an essential role when it comes to quality of life and whether or not someone is able to achieve their vocational, financial, and personal aspirations. Since day one, we've worked to expand access to high-quality, affordable health care for all Coloradoans across our state with the support of the Biden administration. I believe all roads lead to health, or in other words, many factors from food to housing to education open the door to wellness. As part of this work, I convened 2 health cabinets, including one that brings all state agencies together to discuss topics ranging from health equity to the social influencers of health. I also serve on the CU Cancer Center's Community Advisory Council. It's been an incredible honor to serve as Colorado's Lieutenant Governor, working alongside Governor Jared Polis to build what we call a Colorado for all, a place where people of all identities, walks of life, and backgrounds have the opportunity to thrive. We've made great strides building on the Affordable Care Act championed by President Obama and then Vice President Biden when it comes to saving people money on health care by increasing hospital transparency, launching the Colorado Option and the reinsurance program, creating the Prescription Drug Affordability Board, and lowering the cost of insulin and EpiPens. We've also protected the right to access contraception and abortion and ensured providers in the state are safe to do their job. So I'm hopeful that the White House's initiative will advance health and wellness in the state for populations traditionally left out of the conversation. And with that, it's an honor to introduce our next speaker who's visiting Colorado as part of her White House initiative on women's health research. It's my pleasure to welcome First Lady Dr. Jill Biden.
Thank you, Lieutenant Governor Prima. You're a fighter and a true champion for the people of Colorado. And Diane, you took my breath away last night. It was very cold and late. And you were out at the airport to welcome me to Colorado. So your service knows no bounds. Thank you. And, I was actually kind of surprised when the plane landed and I put up the shade and I was like, oh my gosh, it's snowing. Don't you know it's April? But anyway, today marks 25 years since 12 students and a teacher were killed in the shooting in Columbine. And in this community almost 12 years ago, the same pain ripped through Aurora. This has to stop. Enough funerals, enough death. President Biden knows that. And that's why he's doing everything he can to protect our communities. But he can't do it alone. And Congress must act to end this senseless violence. So I'm asking you if you would please join me in a moment of silence. Thank you. I know that's a little distracting, but we gotta just thank God we live in a democracy and we let that happen. And Mayor Coffman, thank you for helping us make women's health research a priority for the women of Aurora. And you have dedicated yourself to common sense solutions for the people of Colorado, and the President and I applaud your leadership. President Solomon, the University of Colorado is making a tremendous difference, and we are at an incredible inflection point, ready to make significant advances in this woman-focused research, and your leadership will help lead the way. So thank you for all joining us today. Thank you all for giving me part of your weekend. I appreciate it. So if you ask any woman in America about her health care, she probably has a story to tell you. You all know her. You may even be her. She's the woman who gets debilitating migraines but doesn't know why and can't find treatment options that work for her. She's the woman going through menopause who visits her doctor and leaves with more questions than answers, even though half the country will go through menopause at some point in their lives. She's the woman whose heart attack isn't recognized because her symptoms don't look like a man's, even as heart disease is the leading cause of death among women. And this is why we're here today. Too many of our medications, our treatments, and medical school textbooks are based on men and their bodies. And that's because women's health research has always been underfunded and understudied. Even though we've made great strides in the last 20 years, women are still seeking health care in a medical world largely designed for men. In November, my husband, President Biden, changed that. He launched the White House Initiative on Women's Health Research to fundamentally transform how our country approaches and funds women's health research. So Joe Coleman, this is the right room for that. So Joe called on Congress to invest $12 billion into women's health research at this year's State of the Union. And we're pushing forward innovation that could be life-changing for women. We're making sure that when the government funds research, that work includes women from the beginning. And when we make discoveries, those ideas get to the women and their families waiting for answers. That's the power of research, to investigate and innovate, to help and heal, to build a better healthcare system. And somewhere in this room may be the idea that will cure cancer, cure heart disease, cure Alzheimer's, heart health, brain health, chronic diseases. You might just have the answers if we only dissolve the barriers standing in your way. Through the White House Women's Health Research Initiative, we begin to do just that. We will start to write new stories about women's health, ones where women leave doctors' offices with more answers than questions, where no woman or girl has to hear that, hey, it's all in your head, or it's just stress. We'll never hear that again. Where women don't just survive, they lead long, healthy, and happy lives. Thank you.
I'm up.
You're up. Did you want to introduce yourself too?
Yeah, I shall.
Okay.
But first I wanted to thank the Lieutenant Governor and the Mayor, and most of all, Dr. Biden. So thank you for everything you're doing, all of you. And thank you for hosting us today. So my name is Carolyn Missouri, and I am the chair of the White House Initiative on Women's Health Research. And it's really a pleasure to be here for this listening session. It gives us so much information and so much power to amplify our message, to hear what you're doing at this great center. And so what I thought would be the most helpful thing to do today is to really think together as we listen to a variety of people talk about their research. And I'd like to start with Dr. Regensteiner. I've known Judy for a long time, and it's been my pleasure to know her. She's very innovative in the way in which she conducts research, and she's very inclusive in terms of her interdisciplinary perspective, which is very much what's needed today in science. And so it's a pleasure to know her, a pleasure to call her a colleague and a friend. And Judy, I wonder if you could just tell us briefly a little bit about the Ludeman Family Women's Health Research Center, and just really for the purpose of orienting us to the center.
So I'm Judy Regensteiner. I am Distinguished Professor of Medicine, Judith and Joseph Wagner Chair of Women's Health Research, and the Ludeman Center, the Director of the Ludeman Family Center for Women's Health Research. So there's a women's health theme in there. If you haven't heard that. I am really proud to be a scientist, a mentor, and a center director at the University of Colorado Anschutz Medical Campus, a place that has encouraged me and supported me as I pursue my dreams and passion to study women's health. I want to thank very briefly so many people who have worked to make this event so unbelievable, including the teams from the University of Colorado, the White House, and the Ludeman Center who worked tirelessly to make this happen. I want to thank Colleen Church, Elizabeth Hepworth, Bree Aguila, and Devin Lynn in particular. Thanks so much to Lida Ludeman and her family, as well as the Anschutz Foundation. Warm thanks to our advisory board, well represented here today, and all of our philanthropic partners. They all had the vision to recognize that women's health is a necessity, not a luxury. It's a necessity for a healthy society, and I really appreciate it. Women's health research is still and remains very understudied. And I tell people that sometimes I think they're thinking she's exaggerating. I'm not exaggerating. That's why we're here today. And Dr. Biden and the President have recognized this is what we have to do. The profound gaps in knowledge led to our founding of the Ludeman Center 20 years ago this year. And we've made great progress, but there is still so much to do. The Ludeman Center has the three-part mission of conducting leading-edge research in women's health and sex differences across the lifespan. So we have many pediatricians in our group as well as adult physicians. And the second part of our mission is to mentor and train, those physicians and PhDs, and then to share the knowledge with the public. And people told me when we founded the center, said, the public will never be interested in learning about research. I said, that can't be true. And I was right, fortunately, and the many people on our board and in our public get to hear from us about what we're finding in lay terms. And we have a goal to reach out to the broad, diverse public in Colorado to make sure, and the nation, make sure everybody gets the information they need so that they get evidence-based care, which is key. We also have, in addition, we're focusing on our cardiovascular disease and diabetes areas of focus today because we focus on cardiovascular disease, the biggest killer of women, diabetes also a major killer of women, and through cardiovascular disease, and mental health. But we're not talking about our mental health as much today, but we have Drs. Epperson and Bale in the audience who are experts in mental health. And mental health, people may not realize that, but depression alone, much more prevalent in women than in men, is the biggest cause of disease burden of all diseases. So there is so much work for us to do in that area also. And a lot of our talented young researchers are here as well, which is always a joy to see them.
Yes.
It's one of those. So my own research is in the sex differences and the cardiovascular consequences of type 2 diabetes, which is a common metabolic disease. It's very pervasive in affecting the metabolism of the whole body, especially with regards to insulin and glucose. And probably many of you are aware of it. About 38.4 million, that sounds pretty exact for approximately, but 38.4 million people have type 2 diabetes in the United States, and most of them will end up dying, sadly, of cardiovascular disease. And I'm not going to talk, about half of those people are women. And so it's a very prevalent disease, but for some reason women have worse consequences. And I'm not going to go into my research today. I'm going to turn things over to my colleague, Dr. Rush, but we work together as a team on our R01 funded research, and it's very exciting. And all I can say is my heart is just so overwhelmed with joy to see this focus on women's health. And I thank you again, Dr. Biden.
Thank you, Judy. Thanks so much. Very nice to hear those remarks and hear you outline the center. As you're saying, diabetes is a focus of this center, and so it seems very apropos then to turn to Dr. Rush, who's an expert in this area and really has dedicated her career to this work. And as Judy mentions, one of the things that intrigues us about this is why women, in fact, do have worse outcomes in terms of their health when they have diabetes. I wonder if you might tell us a little bit about that, Dr. Rush.
I would be so thrilled to. Should I tell you kind of who I am first?
I wish you would, because I also made that mistake of not identifying myself.
My name is Jane Rush, and I am a professor of medicine, bioengineering, and integrative physiology, and have the great honor to be an associate director at the center. My clinical role is as a diabetologist, so an endocrinologist focused on diabetes, where I take care of veterans with diabetes, men and women. And it's an honor to work, as my children tease me, as an employee of the federal government, as well as state government, taking hopefully outstanding care of veterans. One of my goals over the course of my career is to know everything that is knowable about diabetes. And along that line, we came across the fact that women, one diagnosed with diabetes, will have a higher burden of cardiovascular disease, a higher burden of depression, a higher burden of diabetes distress. And when they succumb to a heart attack, they will actually have worse outcomes and a much lower likelihood of even leaving the hospital. And then my other colleagues here today are going to tell us about heart failure, and women are twice as likely with diabetes to be hospitalized with heart failure. Mm-hmm. So, diabetes is bad. We're going to accept that.
That's right.
Diabetes also it encompasses 1 in 4 healthcare dollars in the United States, both for healthcare provision and loss of productivity. Our research is to try to understand some of the earliest events in the lives of a person with diabetes. We study adolescents as well as adults, men and women, girls and boys. And we have discovered in one of our first ventures together that people with diabetes, and specifically women with diabetes, have about a 20 to 25% decrease in their maximal exercise capacity. Oh. What the heck is that, and how many people are exercising to maximal exercise capacity? Not that many in day-to-day life, but it turns out that your maximal exercise capacity is a more potent predictor of how long you will live, regardless of what disease you have. And so the idea that women and men have lower exercise capacity, and this is more greatly affected in women with diabetes than men with diabetes, portends a poor outcome. Mm-hmm. They also, the women with diabetes, and particularly adolescents or young women with diabetes, premenopausal, have a quadruple increase in their cardiovascular risk, and they've lost that cardioprotection.
Wow. Impressive numbers. And yeah, I just am listening to you. I want to ask, though, is this on the rise with the increase that we're having in the country with obesity?
Yes, it is very much on the rise. And while diabetes in adults affects women and men equally, with the exception of China, women, in the rest of the world, epidemiology would show that twice as many young girls and young women are affected by diabetes than men.
Wow. So it's a global problem as well as a problem that exists in our country. Thank you very much, Dr. Rush. Appreciate it.
Thank you.
Yeah. So I'd like to transition over now to Dr. Broussard, And I wonder if you could tell us something about the work you do. My understanding is you focus a lot on the benefit of sleep.
Yes, exactly. So my name is Josiane Broussard. I am a faculty in the Division of Endocrinology, Metabolism, and Diabetes here at CU. And I have been a Ludeman Center scientist actually since 2017, and have been really fortunate to get so much mentoring over the years, both career mentoring but also personal mentoring, to be honest. So I study the link between sleep and health, just like you mentioned. And in particular, we know that people who don't get enough sleep or have disrupted sleep or poor sleep quality have an increased risk for many different diseases. I specifically focus on the link to diabetes, but we also know they have an increased risk for obesity, heart disease, depression, many types of cancer, and overall just increased risk for death. But we really don't know why that's the case. It's still fairly a mystery, even why we sleep. But we also know that women experience much higher prevalence of insomnia specifically, which also spikes, as you can imagine, around life transitions like pregnancy, after childbirth, and during menopause. And just like you mentioned, Dr. Biden, people saying, oh, it's just stress, or go to sleep earlier, or sleep when the baby sleeps. Like, these are not always things that are possible to do. So that's really what we focus on in my lab.
Thank you.
That's very exciting. I actually started out, before I got my advanced degree, at the NIMH in the intramural program, and I worked in the sleep laboratory there. And people really didn't understand the architecture of sleep, and they didn't really understand a lot of the benefits of sleep. They were trying to at that juncture. Would you say that there's been a lot of progress in that area?
Oh, that's like the biggest question in sleep research, to be honest, is why we sleep. So we know that it's restorative, but we still actually, it remains a mystery, like what each stage of sleep actually does. But what you mentioned about mental health, we also know that sleep problems are actually the #1 cause of relapse for opioid use disorders. So even though sleep is highly regulated, we have these really distinct stages, but what each stage is actually doing is still quite a biological mystery.
And it's also my understanding, is this correct, that women are more likely to have insomnia and sleep disturbance than men?
Absolutely, yes, definitely higher rates of insomnia, higher levels of disrupted sleep, along with an idea that women likely have a higher sleep need. So there's definitely a mismatch likely in the quality and quantity of sleep that women are getting, for sure.
It's such an important area because it directly relates to our health.
Exactly, it touches every disease possible that you could list, really.
Great. Thank you so much for that. Appreciate that. Next, Dr. Pena. We're hoping to hear from you. You have a little bit of a different background. You're a chemical engineer by training. Can you tell us how you got involved in medicine?
Right. Yes, I'm a chemical engineer, and I also been training in bioengineering and cardiology as well. I basically got into women's health because of some family problems. We get affected by cardiovascular disease quite often. Several of my relatives have passed away due to this condition. And something that catch my attention is that women and men are completely different. We have completely different outcomes. And so that's the reason why I want to focus my career in study sex differences in heart failure. As I mentioned, I'm an engineer. I'm specializing in women's health. My research is focused on heart failure and sex differences in heart failure, which is a condition in which the heart is not able to pump blood efficiently to the rest of the body. Now, there are one type of heart failure that affects more women than men, and unfortunately, the treatments for this type of heart failure are not working very well. And so, as an engineer, I'm focused to engineer cardiovascular therapeutics, specifically designed for women's cardiac health. Also, I want to mention that I'm an educator and a mentor, and I think it's really important to train the next generation of students to be able to think about how to incorporate in their research women's health, because it's really, really important.
So when you, yes. Thank you. Just one follow-up on that. When you talk about your work, are you talking about devices in particular?
Yes. Well, we have several approaches. Just to mention one of them, we have one engineer strategy to deliver drugs more efficiently to the heart. And something very interesting that we found is that when working with the female heart, we need to consider or to change the parameters that we use to make it effectively in the women's heart. And if you think about it, I think this is very interesting because most of the therapeutics for heart failure have been developed only in studies that include men. So they are basically used for men, not for women. And we need to do better.
Yes, yes.
We will do that.
Yeah, we will. Thank you. Thank you so much. And now I know we've got a nice segue to cardiology with Dr. Kiao. And I wonder if you could tell us a little bit more about, because you're interested in heart failure as well. Tell us about yourself. Introduce yourself first.
Sure.
And tell us about the work that you do.
Great. Thank you, and thank everyone for being here today. This is a really great opportunity. I'm a cardiologist here at CU. I'm also the director of our Center for Personalized Medicine and our Health Systems Care Innovation Center, which partners with young companies. My research with the Ludeman Center has comprised about half of my research career, so I started about 30 years ago, if you can believe that, and I've been with the Ludeman Center for about 14 of those. I study heart failure as it affects women, and some of it are things that only affect women. For example, diseases of pregnancy, heart diseases of pregnancy. Some of it are heart conditions that preferentially affect women or differentially affect women compared to men. I do think about the fact that the therapies we have, we don't really know how they work, or we know that they don't work as well in women as in men. But there are also issues like inequity of access. So let's say we have a therapy like a heart pump. A woman is less likely to be offered that than a man, and even when offered is less likely to accept it. So, why is that? It's a life-saving therapy, and it's a very complicated situation. So those are the kind of things I think about. I'm a data scientist and work with large sets of data, mostly clinical machine learning and artificial intelligence methods. But really the goal is not so much to make algorithms to decide things, but to understand better how to treat women effectively in a way that they reach their goals with the condition that they have, in this case heart failure. I think that one of the real challenges is that everybody at this table is generating a lot of knowledge about how women's health differs than men's health, especially with respect to the heart. But the community doesn't always know that. Providers don't know that, or it takes a long time for them to learn that. So an equally important part of my work is to say, well, how do you engage doctors, engage patients so they know this is actually different and you should think about it, rather than waiting for a generation of new doctors before that gets into the community.
That's really fascinating because you bridge then the clinical with the newest kinds of technologies like AI. AI has some controversy attached to it, as I'm sure you're very well aware. I just would ask you, because my sense is that with all of these data that we have, there's no way to really mine it successfully unless we have these mechanisms to go in and dig down and really understand so that we can become more precise, I think is what you're telling us about what we see in front of us and how to treat us. But I wonder if you could just say something about AI and machine learning and what that is.
Yeah, so AI and machine learning, as it's thought in healthcare, is the use of lots of information that a person couldn't normally integrate in their head to create predictions or judgments or suggestions about what to do. And I think there's a lot of concern because we don't know what's going on a lot of the time under the hood with those things, and it's our health, and that's terrifying, even for me. So how do you reconcile that? And the philosophy I have and we have here generally is that those tools are really intended to create the best information upon which people make decisions, so that you can have the best prediction, should I have this surgery or what will happen, and then talk to somebody about whether they want to do that or not. Not decide this person should have this surgery and this person should have that. It's really a supportive thing, and it sounds a little weird, but I think the way that I will hope to do it, AI would help reclaim the humanness in healthcare rather than replace it, by letting us focus on those things.
Letting us understand the person better.
Yes,
Yeah.
right, and then to serve them better. Yeah.
Great, thank you. I don't know if anybody, if Dr. Biden, if you have a question or if anybody would have a question, but it seems like, first of all, every time we come to one of these sessions, we learn so much more.
I know.
And as you said earlier, we could spend a day here and we still wouldn't learn
A
everything.
year.
But fortunately, we do get these important nuggets that we can take with us. And there's no, that's not a pun on gold in Colorado. But there are these important pieces of information that we take with us and we really value. It's our goal to learn as much as we can and not to make decisions about change in a vacuum, but to really be well informed. And I can tell you personally, as a clinician, as a researcher, that I've been extraordinarily impressed with the dedication to this initiative and the caring about this initiative that the President and Dr. Biden bring to it, and I thank you for that. So I think at this juncture, I need a signal from Marty about, are we about ready to wrap? Because I know you have a schedule for us. Yes, and I'm getting the thumbs up. So sadly, I think we're going to have to take our leave. But again, I just wanted to thank everybody for coming today and having the opportunity to meet you and talk to you, and also having the opportunity to hear from all of the scientists here today. It's been a real pleasure. Thank you so much.
Thank you.